The pressures on women to have children are starting earlier and earlier, this time in their 20s. There's a new survey. It reports 72% of Gen Z women are experiencing age-related fertility anxiety as early as the age of 23. You may not be surprised when you hear where some of that pressure is coming from. Here with us now is double board certified fertility specialist, Dr. Lisa Becht. Doctor, welcome to the show.
Hi, thanks so much for having me.
Your clinic, HRC Fertility, is behind this report. I have to tell you, this sparked a conversation in our very newsroom. My first question, these women are in their early 20s. What is driving the age-related anxiety women are feeling at such a young age?
I think it's actually really related to social media. A lot of women are very open nowadays about their infertility journeys. And so other women, especially younger women, might be seeing their journeys on TikTok or Instagram. And because of that, it's great that they're more aware of age-based infertility, but it's also driving this anxiety, unfortunately.
Should you have your anxiety this early on in your 20s? I mean, women have their 30s and 40s to worry about it. The study also reveals nearly half of American women feel pressure to have children before the age of 30. I feel like that's been going on for decades. If having kids is a priority, what are the realities on what age range is best?
So definitely most women will have plenty more time than their 20s. But that being said, there will be some women that do have difficulties. So I always say that if you know that you're not trying to get pregnant, especially from a career or lifestyle standpoint, at least getting your ovarian reserve checked, which is checking your ovaries for hormones and an ultrasound, can at least give you maybe a little bit of peace of mind in your 20s. And if you did find that there's very low numbers, potentially considering doing something like egg freezing or embryo freezing. That being said, we really use that age 35 to say that at that point, we're worried about your fertility declining in terms of being able to get pregnant. And then in terms of carrying a pregnancy, if you've already frozen eggs or embryos, really we can go a lot older than that. So I think it's great to have more information about fertility, but definitely a lot of these younger 20s women, hopefully you still have plenty of time, but just being aware of fertility is great.
I'm glad you said that. Hopefully it will ease some of the anxiety for these young women. The U.S. fertility rate is now an average of 1.6 births per woman. This number falling drastically over the past few years, and that's not really a surprise with the economy and more women going to college and starting their careers. Talk to us about some factors on why the number is falling. And if you look at this graph, I mean, if you look between 1965 and 1975, there is a drastic drop in a decade.
Yeah, there's definitely major drops. I think it's also relating back to women and what they're doing nowadays. Women are often waiting a lot longer to get pregnant. So because of that, age, the time that they have to have babies, a lot of women are having less births. That being said, there are kind of the issues with infertility. There definitely are still options if you have infertility and can't get pregnant with your own egg. But I think just in general, with just changing kind of lifestyles, people are definitely having less babies and at much older ages.
With the average age of mothers giving birth about 30 years old, when should a woman consider seeing a fertility specialist? How long before trying to conceive naturally, doctor?
If someone's under 35, we would say really they could try up to a year without concern. That being said, if they know that they have a major medical problem that would affect fertility, I would definitely say coming before that. For someone between the age of 35 and 40, really at 6 months of trying, I would say coming in for testing. And if someone's at 40 or above, at that point, I would come in immediately just so we could do some testing, because if things are concerning, we could just get into treatment a lot quicker.
I am curious, are you seeing more women in their 40s having babies, at least compared to the past?
Absolutely.
You have.
Definitely, really, we go up to the age of 55 from the American Society of Reproductive Medicine guidelines. That being said, really someone in their mid 40s and above, that person getting pregnant is either coming from eggs or embryos they froze in the past, or potentially using a donated egg or a donated embryo. So definitely there is ability to get pregnant at much older ages than typically what people might think, but it would require the help of someone like myself.
And again, hopefully that eases the anxiety of so many young women in their early 20s. Dr. Becht, you specialize in women's fertility. What are some common causes of infertility? I think all of us know a family member or have several friends who have dealt with this.
Yeah, really nowadays, I would say the biggest cause would be age-based infertility. So we just know as we get older, unfortunately, the ability to get a good, healthy egg is going to go down. Outside of age, though, definitely if there's problems with that egg coming out, so something like polycystic ovary syndrome is pretty common. Endometriosis could impact the actual quality of the egg, the structure of the fallopian tubes, fibroids in the uterus, and then previous medical treatments. For example, if someone had cancer and was exposed to chemo or radiation. So lots of different potential impacts on a female. And then we can't forget the male side. So definitely male factor infertility is also a big one. Typically, when I do testing for my patients, we're often find something on both sides. So as much as we focus on the female, we always say it's really the couple, or if it's a female getting pregnant on her own, there's options with donated sperm.
You and I are talking about how women are having babies later in life, whether they're getting married later or just starting their careers a lot earlier. For women who are trying to conceive after the age of 35, what advice would you give them?
I would definitely say coming to see a fertility specialist, if they're having any concerns at all, just to do some testing. But really beyond that, there's a lot of things women can do on their own. So definitely taking vitamins, optimizing lifestyle, being as healthy as possible. All of those things are hopefully going to help them as well.
And you know this as well as I do. I have no doubt this conversation is happening at many kitchen tables because so many people deal with this. Dr. Lisa Becht, thank you for joining us this morning and separating fact from fiction. There were a lot of questions here.
Thank you so much. It was great talking with you.
Thank you.